I'm Amanda Grace, and I'm a naturopathic doctor, board certified. What I'll be speaking about today is the power behind the pump, and I think it'll be self-explanatory as we go. All right, this is the secrets of microcirculation. I know not everybody that's watching this presentation is a naturopath, but I am, and I know a lot of other health professionals will be watching it. So I'd like to address our goal as natural health practitioners. And if you're a natural health person that enjoys eating well and taking care of yourself without drugs and surgery, then you'll appreciate this as well. That our goal is getting to the root cause of dis-ease and allowing our body to heal itself through the removal of obstructions to health and by restoring the body's ability to absorb nutrients and oxygen. How can we get toxins out of the cells if the highway is blocked? How can we deliver groceries if the trucks have no drivers or gasoline? The supply line challenges we're experiencing worldwide right now are analogous to the dysfunctions in the microcirculatory system. The heart is a pump, right? Well, Dr. Cowan offers up a daring claim. Not only was Rudolf Steiner correct that the heart is not a pump, but our understanding of heart disease with its origins in the blood vessels is completely wrong. And this gross misunderstanding with its attendant medications and risky surgeries is the reason heart disease remains the most common cause of death worldwide. We know that the heart does pump, but I submit that is only part of the pumping action of the circulatory system. What is microcirculation? Well, it includes 74,000 miles of microvessels. The microcirculation includes all of the vessels with a diameter of less than 100 microns, such as arterioles, venules, and approximately 10 billion capillaries, which are 1/20th the size of the human hair. It also includes the interactions between blood components, such as blood gases, waste products, nutrients, hormones, and water, plus the endothelial lining of the vessels, which we've heard a lot about recently, and the glycocalyx, that is a glycoprotein and glycolipid covering that surrounds and protects epithelial cells. The microcirculatory system also includes cell adhesion molecules, which enable cells to adhere to each other. What we're discussing makes up 74% of your entire circulatory system. The microcirculatory component of the circulatory system is the most crucial part of that system. This is where the exchange happens, where the rubber meets the road, if you will. And this is where the exchange is between the organ of blood and all the other cells of the body, the cells of other organs and other body systems. If all of the 74,000 miles are not open and functioning properly, much of our tissues will not receive the oxygen and nutrients needed for proper functioning. Proteins and metabolic waste must go from the cells to the capillaries. Simply put, the cells deprived of oxygen begin to die. Functional state of the body is based on microcirculation. What's vasomotion? You may not have heard of this. It's also called angiokinesis, and it was first observed by Thomas Wharton Jones in 1852. It is the pulsing action of smaller arteries and veins in a rhythmic frequency. 3 to 5 vasomotions per minute is the functional range. Functional meaning proper perfusion of the tissues is accomplished. Insufficient microcirculation is arguably the root cause of nearly every disease. Insufficient microcirculation may be defined as few as 1 pulse per 10 minutes. Most important this is a regulatory system for perfused cells. That means the blood and the oxygen are getting to the cells, tissues, and organs. And that is the vasomotion. Larger arterioles contain receptors that can be influenced chemically with drugs such as beta receptor blockers and natural supplements such as beet juice to boost the nitric oxide production and increase vasodilation. The smaller arterioles don't have those receptors and can only be influenced by physical stimulation. The neural or humoral control versus autorhythmic. When the microcirculation is improved physically, then the delivery of specific therapeutics, whether chemical preparations or herbal formulas, can be improved. This allows medication to reach the targeted cells, tissues, and organs, possibly allowing for reduced effective doses of medications. This is crucial for the elderly who may be on several medications with competing side effects. Professor Christian Alkjaer presented his findings at the Microcirculation Research Joint Meeting in Pisa in 2016. Quote, "The uncoordinated reaction of the endothelium cells is synchronized in a local depolarization and triggers the endothelium-mediated tonus regulation, which can then be presented as vasomotion, an autorhythmic local phenomenon." Dr. Ralph Berger continues, "Medicinal approaches are vulnerable in one important point. In order to take effect, they depend on the microvascular distribution mechanism of the patient, which is restricted anyway, and appropriate receptors in the precapillary arteriolar section. This receptor deficiency presents a not insignificant hurdle for an efficient medicinal therapy." Small blood vessels and big health problems. This is a microcirculation study from the Journal of the American Heart Association. Sex is a critical biological factor that affects microvascular pathophysiology. The relative concentration of sex hormones that exist both in males and females varies, which means these factors vary across their lifespan. We see sex correlated differences in incidence and presentation, meaning risk factors as well as symptoms of cardiovascular disease, chronic kidney disease, and vascular dementia. Of course, preeclampsia, menopause, and erectile dysfunction are sex-specific conditions related to sex chromosomes and sex hormones. And each of these conditions is associated with small vessel dysfunction, your microcirculation. Microvascular complications are well-recognized effects of long-standing hypertension or diabetes, as well as the resulting neuropathy that accompanies that disease. In addition, quote, "Dysfunction in small blood vessels themselves cause or contribute to a diversity of diseases and pathogenic processes, such as hypertension, coronary microvascular disease, which we'll discuss shortly, pulmonary hypertension, sepsis, focal strokes, microinfarcts, large cerebral hemorrhages, or microscopic hemorrhages, which are microbleeds, as well as dementia. Additionally, subtle long-term changes in vascular structure and function can lead to cerebral white matter damage and cognitive dysfunction. And none of us want that, right? Negative microvascular changes, such as those underlying chronic hypertension, can occur very early and exacerbate other pathological processes in many tissues and organs, unquote. Dr. Michael Blessing, a urology and men's health specialist, reports in the Haug report in 2016 of successful treatment with vascular therapy of 2 patients with erectile dysfunction. So what happens when tissues and organs are not supplied with the needed nutrients and oxygen? What happens when those organs are not able to detoxify well because of deficiencies in the microvascular system? Are conventional drug treatments effective if they cannot reach the targeted tissues and organs? Let's briefly evaluate what dysfunction might look like in each system and how it might be affected by poor microcirculation. In the case of the skeletal system, let's consider bone fractures. Might well-perfused bones be less likely to fracture, stronger in general? Can that tissue be repaired in a timely manner without proper microcirculation? Stage 1 includes damage to the blood vessels themselves. So that repair must take place in order to facilitate the following stages. In stage 2, the hematoma is replaced by inflammatory molecules. These molecules are delivered by your microcirculation system and CAM1. They clean out the dead bone and prepare the fracture site for new tissue formation. Stage 3 involves a delivery, keyword, of osteoblast and osteoclast needed to remove damaged bone and build new bone. Capillaries and supporting blood vessels are crucial in this delivery process. This whole process can be done more quickly and efficiently with an optimized microcirculatory system, often in weeks versus months. Other skeletal symptoms related to poor microcirculation include frozen shoulder, osteoporosis, joint pain, and inflammation. A study published by Dr. Richard Westhouse showed that using this specific vascular therapy as a complement to medications, he was highly successful in reestablishing impaired circulation and thereby delivery of the chemical therapeutics in 50 patients with bone marrow edema. The respiratory system is obviously where the blood is reoxygenated and carbon dioxide is eliminated through exhalation. The pulmonary capillaries in the alveolar walls form a dense network and large surface area crucial for proper gas exchange. The muscular system relies on proper supply of oxygen and removal of lactic acid after exercise to allow for muscle growth and recovery. The density and distribution of capillaries is crucial to support muscle size and strength development. Dense capillary beds contribute to optimal muscle oxygenation for quick repair of muscle injuries, including micro tears, which are important to muscle growth. Conversely, poor capillary perfusion may result in delayed onset muscle soreness and muscle hypertrophy, commonly seen in the aging population. Some of the ways we can see microcirculatory obstructions causing problems in the circulatory system include high blood pressure, chest pain, and irregular heartbeat. Certain medical problems such as abdominal aortic aneurysmal disease, venous insufficiency, hypertension, high cholesterol, peripheral vascular disease, diabetes, and chronic renal failure are associated with reduced microcirculatory vasodilation. Also with advanced age, obesity, and menopause, the microcirculation problems tend to increase. This study from the Microcirculation Journal investigates the effects of microwave radiation on the microvasculature. Quote, rats were exposed to microwave radiation. Microvascular diameters, flow velocity, blood perfusion, and permeability were measured. Cultured endothelial cells from microvessels were subjected to microwave radiation. Cytoskeleton, apoptosis, protein synthesis, and markers of the endoplasmic reticulum stress. I will skip some of these technical parts. Those things were examined. The results, this is the bottom line, they were that the microwave radiation decreased microvasculature diameters and blood flow and increased the permeability of the microvessels, so there was leakage. The conclusion was that microwave radiation induces microvascular injury and triggers the cell death pathway in the endoplasmic reticulum. This might be slightly off topic, but related to the last article. I wanted to show the universality of this single cause of microvascular damage. This is an article by Jamie Lee. Quote, over the past few years and secretly for decades, scientific and medical evidence has shown conclusively that the low frequency pulsed radio and microwave frequencies are causing significant damage to our cells, resulting in extreme increases in autism, heart irregularities, brain wave changes, cancer, and generational fertility destruction in males, and even more significantly in females, unquote. The microwave technologies exerting their negative influences on us are shown in the photo. We need to try and minimize our exposure as much as possible, but also using EMF blocking technologies and other things we can do to keep our microcirculation pumping. Since we are being exposed to these things, we need to take extra efforts to keep the microcirculation in top shape. We can do earthing, which is getting outside and putting your feet on the ground for 20 minutes, getting out in nature, and using positive physical vascular therapy. This study on rats aimed to investigate the pathophysiology of hepatic microcirculation. And it's especially in non-alcoholic fatty liver disease. The results were a high-fat diet causes significant increases in leukocyte rolling and adhesion on hepatic microcirculation and decrease in liver microvascular blood flow. This is important. Liver tissue presented increase in oxidative stress and inflammation. At 20 weeks, there was a significant increase in age content in the liver and the serum of the high-fat diet fed rats. The conclusion is that the increase in the high-fat diet caused microcirculatory disturbances, and they could play a role in long-term damage and poor health of the liver. That's an important part of our body, something we all need to be taking special care of. Next, we have a video. This is real-time, spontaneous, normal vasomotion in the intestinal vessels. Please pay attention to the autorhythmical diameter changes in the arterioles. You'll see them expand and contract. This one's slowing down the blood flow here. Once it opens up again, it'll dilate and the blood flow will increase again. So you'll see shrinkage and expansion in the vessels that will keep the blood flowing. This is part of the pumping action. This is the power behind the pump. Microcirculatory flow in the digestive system is required for a variety of functions. This is intestinal blood flow here, what we're looking at. The functions include fluid transfer required for salivary, gastric, pancreatic, and biliary digestive enzymes, as well as playing a major role in removing fluid from the intestines during the absorption process. It also prevents gastritis and stomach ulcers. This 2016 article from the journal Neuron points out the brain's need for oxygen. Of course, you knew we would get to this because the brain is our primary tool for controlling the rest of the body. This study demonstrates that microvessels in the brain play a key role in reacting to spikes in demand and accelerating the flow of blood to respond to neuronal activity. Optimal microcirculation in the nervous system is crucial for a healthy brain, cognition, sleep, and memory. Sleep is of utmost importance for continuing brain health and its ability to detoxify at night via the glymphatic system. Headaches, dizziness, and strokes can result from poor microcirculation. In the Haug report published in 2016, Dr. Ulrich Zeltz states, quote, "The role of the supply of blood in the brain during a migraine attack has been scientifically acknowledged since the 1980s. Once the excitation front has passed through the brain cells fall into a state of lethargy. During this phase, inflammation and pain transmitters are secreted, such that the blood vessel walls become inflamed. This is what causes the pain. Consequently, a dysfunction of the microcirculation system occurs. This causes the attack and the aura to form. The brain cells receive too little oxygen and nutrients, which means they can no longer perform their function. So migraines, if you've ever had them, they're very uncomfortable. They can set you back in what you need to get done. And really, it's scary to think about. It's not just pain, but it's causing the brain to not perform the functions that it should. Speech disorders, visual defects, auditory losses, and even paralysis can occur. When the microcirculation is restored, the pain transmitters and chemical messengers are excreted, and the oxygen and nutrient supply is reestablished. In my own experience as a clinician, I had one 12-year-old male presented with daily migraine headaches. One single 8-minute therapy on the microvascular device. This is applying a series of complex signals configuration. It's a particular class 2 medical device that was targeted to the impaired microcirculation, and the migraines resolved. The restoration of the optimal blood flow allowed him to be permanently free of migraines. In addition to migraines, many other types of pain are related to poor microcirculation, such as chronic pain from diabetic neuropathy, chronic pain from fibromyalgia, chronic pain from wounds, degenerative arthritis, and rheumatoid arthritis, chronic pain from osteoporosis, and low back pain. Oftentimes when the optimal microcirculation is restored, the pain, it's not suppressed, but facilitated to move toward regeneration of the tissues. According to the American Heart Association, coronary microvascular disease, sometimes called small artery disease or small vessel disease, is heart disease that affects the walls and inner lining of the tiny coronary artery blood vessels. It's also known as cardiac syndrome X, non-obstructive coronary heart disease. The question asked by the AHA, what causes coronary microvascular disease, or CMD? Their answer is, quote, "Many researchers think," that translates to no one knows, or they don't want to admit, but many researchers think some of the risk factors that cause atherosclerosis may also lead to CMD. There's no answer there. They truly do not know what causes it, nor do they have treatments for microvascular dysfunction. Even the diagnosis is difficult. They say, quote, "Standard tests for CHD may not be able to detect coronary microvascular disease. However, the most common symptoms, listen up, They're fatigue, lack of energy, shortness of breath, and sleep problems. There's a lot of people suffering from this, I think, and don't even know it. Microcirculatory deficiencies have been shown to be caused or worsened due to shock, stress, aging, anesthesia, trauma, sedentary lifestyles, malnutrition, toxins, high blood viscosity, endothelial cell damage, think spike protein, platelet aggregation, drug or nicotine use, and electromagnetic field disturbances, as we saw in the microwave radiation. Now that we've determined multiple universal causes of microcirculatory dysfunction, let's take a few minutes to discuss some more specific outcomes and diseases related to this deficiency. Raynaud's disease is a painful condition directly related to loss of blood flow to the extremities. Diabetic neuropathy and non-healing foot ulcers are also related to microcirculatory blood flow. Insulin resistance and obesity themselves can even be traced to poor microcirculation. Depression and chronic renal failure are also implicated by capillary insufficiency. Lack of oxygen to the cells is implicated in emergence of diseases such as rheumatism and even cancer. One serious condition that is seen, especially in hospital situations, has a direct correlation between microcirculation efficiency and survival. It's not related to coronary output or blood pressure. Distributive shock or septic shock, you've all heard of that. It's a medical condition in which abnormal distribution of blood flow in the smallest blood vessels results in inadequate blood supply to the body's tissues and organs. This is there's a study, the clinical significance of determining the severity and prognosis of sepsis. So what they determined was if their blood flow in the smaller blood vessels was able to be returned to normal, they are much more likely to survive sepsis, which is often fatal. Here's another quick video. I want to show you what we're seeing here is poor microcirculation. This has limited vasomotion, and this is the intestinal area of a 30-year-old male with chronic stress. This video was taken with a device, it's called intravital microscopy. On the right is the venular side, and you'll notice very few white blood cells. They show white rolling along the walls of the vessels. This means that the immune system is not well activated. On the left, there's no vasomotion visible in the arteriole. What you see is restricted blood flow, which equals poor perfusion of the tissues. Too much of this, and you'll feel sluggish and tired. After 3 minutes of stimulation by a specific medical device, you'll already see improvement in the flow and movement. Notice how the capillary on the left has opened up and arterial flow has increased. Now look at the venular flow returning to the lungs to recycle and remove metabolic wastes the body has created. After 6 minutes, you'll see there's an increase in the white blood cells. Pay attention on the right side, you'll see the white blood cells rolling along the endothelial walls. That's your mobile immune system. If your blood is not flowing well, you can't have an optimally functioning immune system, and therefore you aren't protected. If you're perfused, you're protected. Support your immune system with healthy microcirculation. That's what this is all about. You'll see this blood flow continuing even 30 minutes after the stimulation by the vascular therapy. It's able to continue for a significant time. Okay, speaking of your immune system and our current health crisis, if you will, according to Dr. Charles Hoff, it's absolutely inevitable that blood clots will form. This is the body's response to the spike protein. This protein, whether from the wild virus or vaccines or shedding, damages the endothelial wall. This qualifies as microvessel damage, and it causes a protective response by the body. Unfortunately, the microclot blockages in the microvessels are causing a cascade of related health concerns. This is something that can be tested for, and many doctors are testing for with a D-dimer test, and that looks at blood clots that aren't visible to, they're the smallest ones in the microvessels. Dr. Hoff's patients, when he tested them 4 to 7 days post-vaccine, 62% were testing with the D-dimer as positive for the microclots. The next few slides show the results of several randomized, double-blind controlled trials of this specific vascular therapy. This was published in the Journal of Complementary and Integrative Medicine. First, we see increases in vasomotion over 30 days on those subjects receiving the physical device stimulation. Below the 0 line is the control group. This table is looking at tissue perfusion. In the before group, group A, they had 1.3 arterial vasomotions per minute. That's the pumping action. Group B was a younger group, 9 spontaneous vibrations. By day 30, there was a 4.4% increase in the number of blood cell perfused nodes. So what happened was 10 days after, the stimulation effect wears off faster in the older group, but we saw a 38.5% increase in the treatment group, whereas the control group only had a 3% increase. And so the oxygen saturation in the veins increased by 38.5%. According to the Journal of Immunology, ICAM1, or intracellular adhesion molecule 1, is a membrane-bound glycoprotein that plays a central role in leukocyte trafficking, activation of lymphocytes, and numerous additional immune functions. As the chart shows, the group receiving treatment shows significant increases in ICAM1 concentration. Additionally, the number of transmigrating white blood cells increased 59.3% by day 10 and then fell off. This shows that using the physical stimulus creates a quicker immune response, resulting in successful infection defense without causing a continual overstimulation of the immune system, like you would see in autoimmune disease. The number of blood cell perfused capillaries increased by as much as 34.8% over 25 days. So in the A picture, you do not see as many blood vessels. Look how many more of the tiny blood vessels are visible in the slide B. And that was use of the medical device for 25 days. Much of this research has already been done in Europe with over 20 years of hospital and clinical use. I'd like to conclude with another quote from Dr. Ralph Berger. Physical vascular therapy would appear to be the more promising approach. As an established and effective therapeutic instrument, in order to sustainably counteract chronic diseases in a therapeutic, yet above all, in a preventative setting, unquote. We as practitioners and fans of natural health practitioners, we're seeing a lot of microcirculation problems. 9 out of 10 people in industrialized countries. We can introduce this in our clinics, in our homes. We can enjoy this therapy as a prophylactic and a complementary specific physical microvasculatory therapy. Then we can follow up with herbal remedies and, of course, a healthy diet. These procedures can have a profound effect on your circulation and overall well-being. With optimal microcirculation as the basis for healthy cells, tissues, and organs, we can see how adding in-office or in-home therapy to yourself, to your client, and to your friends and family as a self-help to prevent and restore proper microcirculation is well in line with our natural health goals. Thank you.